Good morning, Nigerians, our teaming viewers. You are welcome to your flagship program once again this morning on ITV, broadcasting live this 23rd day of December 2021 from Mpape here in Abuja. I am your host, Ebenezer Oyetaki. We're going to be taking a look at a topic that says Omicron COVID-19, the FCTA vaccination efforts. The FCTA vaccination efforts. And with me to take a look at this morning is Dr. Lawal Lukman. He is the Incident Manager, FCTA COVID-19 Emergency Operations Center. In the characteristic of this program, I return to Dr. Lukman Lawal and I say nationalism and you.
It is my duty and responsibility to build Nigeria. Thank you.
Very well. We often tell people that even there back home, take the same pledge. No one will do it for us. COVID-19, pandemic ravaging the world. And recently, another spectrum was added to it, the Omicron. How have we been faring? What has been our experiences here in Abuja?
Thank you very much. As we are all aware that coronavirus, which is a type of virus, they have ability to mutate. So the COVID-19 came upon because of mutation. Some forms mutated to what we have, which was a stable form, and which at a point the World Health Organization had to give it the name COVID-19. So in that form, it has the ability to keep, as it's dividing, to be changing form. Some of the forms may be stable and have properties that may improve their transmissibility, and we now call them, or some features, which we now call them virus of concern. So, and that is how we now came to the one called Omicron. We've had previous ones like the Delta variant, which was causing more death, but this particular variant has been observed to be able to transmit faster. It's more efficient in terms of transmission, so it has the ability to evade immunity, either those that were acquired naturally from previous infection, which we all know that is short-lived, and also if it is acquired through vaccination. However, the better part of it is that it is less lethal. It causes less death than the Delta variant. And I can put this into perspective for you. In around October, when Delta variant was the prominent variant in Nigeria, we had 1,262 cases in October, and we had 32 deaths. This gives us a case fatality ratio of 2.5%. But in November, as at that time the waves, the peak, we had low transmission. We recorded only 252 cases with 3 deaths, giving us a case fatality ratio of 1.2%. However, in this month in the FCT, we've recorded 3,592 cases between December 1st and 10th. December 1st and today, we've recorded 10 cases, which is giving us a case fatality ratio of 0.3%. So that we can see from these figures that in October, we had 2.5% case fatality. In November, we had 1.2% case fatality. And in December, we have 0.3% case fatality. However, that is the good news. The bad news is that as we continue to have more cases, we are more likely to have the vulnerable populations, which are the ones dying. These 10 people that died are part of the vulnerable populations, people that we already know that are at risk of dying. The elderly, those that have comorbidities, hypertension, diabetics, or cancers, and other chronic conditions like kidney diseases, chronic kidney diseases, chronic liver diseases. They are the ones dying. But also, I want you to note that between October and now, in total, we've recorded 45 deaths. out of these 45 deaths that we recorded during this period, we are aware of the vaccination status of 42 of them. And out of these 42 people that have died in FCT between October and now, that we know their vaccination status, 40 of them are not vaccinated. 40 out of these 42 are not vaccinated. So this clearly tells us that being vaccinated clearly confers protection against all variants of COVID-19, whether the Delta variant, whether the Omicron variant, whether the other circulating variant.
What is the ratio of the spread of the Omicron variant in Abuja as of today?
So the Nigerian Center for Disease Control, who is coordinating the response, if you could recall, on the 1st December, came to notify the whole country that we've recorded our first 3 confirmed cases of Omicron. However, they did not tell us, where these cases are. It is in their own wisdom not to create unnecessary panic, because it does not matter which variant is in circulation in terms of the preventive aspect and response. So irrespective of whether it is Delta or Omicron, it is still the same way we're going to respond, and we're asked nationally to respond the same way. Subsequently, on 7th, we're also informed that there were 3 more that have been identified through genomic sequencing. And a day before Christmas, we were told that the number is now 45, and out of this, in the initial 6 were people that had travel history to South Africa. But now we've been able to demonstrate that even there's widespread circulation. And looking at what we know globally from the characteristics of Omicron, clinically, and what we are seeing in the FCT, it's obvious that we have Omicron around us, and it's obvious that we're already having that community transmission in FCT, looking at the figures in which are given us.
The United, the World Health Organization, about 2 days ago, sounded a warning that the world should stop underestimating the Omicron variant, because people are saying that it is not as fatal as other variants that we had experienced and the rest of it. What is the implications of this, and how are we taking it here?
So, like I earlier said from the figures I've given, we've had more, because we're having more cases, we are likely to have more deaths. The health facilities are likely to become overwhelmed because you have more people falling sick going to the hospital. And also, we'll have more, there will be shift in resources. Resources that are supposed to be used for other things will now be concentrated in treating, in managing of COVID-19 and in the whole response. Because of the increasing number of cases in the FCT, now we need to engage such staff. Our treatment centers, we need to increase the number of healthcare workers that are working there. These healthcare workers are going to be pulled from the general healthcare workers that we have in the FCT. That means that less healthcare workers will be available to handle other conditions. And these two, so even as we are trying to save lives from people from dying from COVID, we can also have people from other diseases that should ordinarily not have died also dying. We call it excess mortality. So that is part of the challenges of having increasing cases. You need to put in more resources. The health facilities will become overwhelmed, and it will affect general service, both the essential services and the COVID-19 services, and more people are likely to die.
You earlier mentioned that among the fatality of COVID-19, about 42 thereabout, 40 of them were vaccinated. I mean, were not vaccinated, were unvaccinated, and which means only 2 were vaccinated. Now, taking it from there, what has been your experiences in the responses of our people in the Federal Capital Territory to vaccination, the drive for vaccination? What has been your experiences as a man on the field?
So, globally, nationally, and locally in FCT, there is a challenge of misinformation. People are getting and are really misinformed, and the social media is not helping matters. But if we look through the historical perspective, either from the biblical, the general history, the Islamic perspective, we always see that people not believing, people being in doubt is nothing new. It's not about because it's COVID. People are always in doubt. But the key thing is, where do we want to belong to? Which group do we want to belong to? Those that know the truth and are not abiding by it. And from the statistics I've given us, this is the statistics of what is happening in the FCT. We can see that it is very obvious that if you are vaccinated, it is not an accidental finding. It is very obvious that if you are vaccinated, you have an higher chances of surviving COVID-19 than not being vaccinated. So I don't know what other information, apart from all the information that we've been given. Vaccination has always been, from the time of smallpox, vaccination has been very good in helping the society. But vaccination alone will not work. In all situations, vaccination alone will not work. Vaccination is just an additional effort to ensure that we surmount this COVID-19 pandemic. So we still need to practice social distancing. We still need to ensure that we wash our hands frequently with either soap and water, or when not available, use alcohol-based hand sanitizers. We still need to wear our face mask correctly. Then, in addition with vaccination, we will be able to surmount this outbreak.
Well, with all the protocols as you have itemized, what has been your experiences with the Federal Capital Territory in particular, that is, people's responses to observing these protocols as outlaid? Are the responses, are people getting more ardent to it, or they are drawing back from it?
Currently, now we are having people not really adhering to this. We're having people not wanting to take vaccination, despite the fact that vaccination is available in all tertiary facilities, in the government tertiary facilities in the FCT. It is available in all secondary health facilities in the FCT, government health facilities in the FCT. It is available in all the government primary health care facilities within the FCT. And also in some selected private health facilities, you can get the vaccination, but we still have people not coming out to vaccinate. And if you've been following the news lately, you will have seen that our enforcement team is currently out to ensure that these are being enforced. The non-preventive, non-pharmaceutical interventions are being enforced, especially during this period of the Yuletide. We've been told that our religious houses and the crossovers ceremonies that will be happening very soon, yes, that they should ensure that people only occupy 50% of the halls. We've been informed that all clubs should not operate during this period. We've been informed that people should stay out, when they want to meet outside. Outdoors is better than indoors. And it's also, in the words of the Director General of WHO, it's better to cancel an event now and celebrate later, rather than to celebrate now and lose someone
and die in this process
and become bereaved later. So please let us, as FCT residents, come out and get vaccinated. Ensure that during this period, as we celebrate, we follow the non-pharmaceutical interventions, which has been proven over and over again to be an effective way of calming down this outbreak.
From the starting of the vaccination in FCT, within the nation, in the nation first, then within the FCT in particular, what will you say is the percentage or the ratio of vaccinations to the population of FCT?
The vaccination, if you recall that at the beginning of the vaccination drive, it was the highly vulnerable population, the healthcare workers, so that we can have them being able to take care of people both in the treatment centers and people coming to the hospital for other reasons. We're the first people that were prioritized to be vaccinated. Subsequently, when we started getting more vaccines, then the vulnerable people, the elderly, people that have comorbidities, and currently now, every Nigerian above the age of 18 years old is eligible to take the vaccination. Currently now, from the statistics we have less than 10% of the Nigerian population having been vaccinated. We've been given a matching order in the FCT to ensure that before the end of January, we vaccinate about 1.5 million FCT residents. Currently, we've vaccinated around 650 from this 1.5 that we're given a matching order to ensure that we vaccinate within this short period. And we are working towards ensuring that that is achieved.
Would you say that we have in stock enough vaccinations to cover this, or we are expecting? Because I remember Mr. Adesina, the African Development Bank president, once said that Africans are being discriminated against in the distribution or sales of COVID-19 vaccinations. Are we having enough vaccines?
We have enough to cover. We have enough vaccine in the FCT to cover the 1.5 million. It is on the basis of the available vaccine that was distributed among all the states and FCT that we're given this target to ensure that we vaccinate 1.5 million more FCT residents. So there is enough vaccine to ensure that this population, this extra number, are vaccinated. And yes, there's that inequity because we are not producing our vaccines. We don't have enough money to buy them. We are relying on donor countries, richer countries, to give us vaccines. They have achieved much more better than we have achieved. And before vaccine will be able to confer that immunity that we all need to be able to ensure that it's more protective, at least we have to have vaccinated like 70% of our population. That is the rule of thumb around vaccination. If you've not vaccinated up to 70% of your population, it's as good as people have not been vaccinated. So we are taking baby steps to ensure that we get to this amount.
Another thing is that we ought to be vaccinated, say, the first jab, the second jab, and do we have third jab?
Yes, there is a booster dose, but the booster dose is optional. The first more important thing is to take the first and the second jab.
Okay. So
if 6 months after you've taken the second jab, then you can go ahead to take a booster jab.
The approximately over 600,000 that has been so far vaccinated, do you think they have had their second jab? All of them?
Yes, they've had. We usually talk, because from what we know, if you've received your first jab, you are closer to the person that has not received vaccination. So it is when you've received the second dose that you've completed the dosage. And so these numbers that we are counting are people that have received their first and second dose respectively. Their first and second dose.
There were also, Nigerians are very dynamic people and very sensitive too, and they are very concerned about their health. There were also a scare of the expired vaccines, because since we don't produce them and the rest of it. So how did we arrive at a vaccine expiring in our hand? Did we not do due diligence to oversee what the expiring date should be and the rest of it, or we just took it for granted?
No. Usually, in logistics, the concept is first in, first out. So we are not producing vaccines in Nigeria. These vaccines, most of them were given to us through the COVAX facilities. So where they are coming from, it is the first in, first out from that place. And because the vaccine is novel, it's new, they have very short half-lives. So by the time they are being transported to get to Nigeria, they already have a very limited half-life. And because people are not coming out as much as they should come out for vaccination, some of these vaccines now expired. Not because we wanted them to expire or we were monitoring their expiring date. We have a system for all drugs that tracked when they will expire. And we try as much as possible to ensure that these drugs are released before the expiring date. But unfortunately, because they came in at a very short, by the time they were arriving in the country, they already have a the vaccines generally have a short life. By the time, before the journey from wherever they are coming in ships and planes to Nigeria, that short life has been reduced again. As in the duration to attain that expiration date is getting close to that, and subsequently, because Nigerians are not coming out as much as they should come out, we find out that some of these vaccines are expiring on us. This is a very, very sad thing too, because these vaccines cost money to bring into this country. To produce these vaccines cost money to be brought into the country. They have logistics in place. Even on Christmas Day, as we are all aware, our vaccinators were on site ready to vaccinate people. They had to sacrifice their Christmas celebrations with their family to be outside to ensure that those that need to be vaccinated are vaccinated. But are those that need to be vaccinated coming out to take the vaccine? So please come if you've not been vaccinated. It's very, very important for your interest as a duty and responsibility in building this country, which this program stands for. Go get your vaccine.
Go get your vaccine. So what will be your last message to both Nigerians and the FCT, particularly where is your operational base, concerning vaccinations?
Get vaccinated, 1. Get vaccinated, 2. Get vaccinated, 3, if you've not been vaccinated, because it confers protection, together with consistently and correctly using our face mask wherever we are, ensuring we practice physical distancing as we celebrate during this Christmas, New Year period, and always, and going forward into 2022, we should make it one of our New Year resolutions, if we've not been doing it before, to ensure that we always use our face mask correctly, and also we should wash our hands frequently as possible. This will help to reduce not only the spread of COVID-19 but other infections. Thank you.
Thank you very much. We have been talking about the Omicron variant of COVID-19. We have been discussing with Dr. Lawal Lukman, who is the Incident Manager, FCT COVID-19 Emergency Operation Center. And two things are germane in what he has said so far. Do not be afraid that when you go to get vaccinated, you might be given an expired one. They are monitoring it. They are monitoring the expiry date because Nigerians, the government, the FCTA authority are concerned about your safety. Secondly, do not hesitate from going to take your vaccination so that those that have been imported will not be wasted and got expired because they cost money. And all of this is for our collective good. Let us get vaccinated and let us observe all the protocols. Continue to observe the protocols in order to save both ourselves, our dependents, and to build the nation, because the human resources of a nation is the greatest asset of nation building. Dr. Lukman Lawal, you are welcome to our studio, and we hope when we have another opportunity to beckon on you, you will make yourself available to us. It's been wonderful talking to you.
Thank you very much. My pleasure, sir.
You're welcome. Thank you. Do not change the channel because we will be proceeding almost immediately into the second segment of the discourse on nationalism and you. I remain your host, Oyetakin Ebenezer.